These are spaces that you find in the head. So we've taken a cross section of the head of a cadaver here, and this is where the brain is going to be. You can see you have got these spaces. You have got this space somewhere near where the frontal bone is. You have got this space here on the middle where the ethmoid bone is, and then you have got actually the sphenoid bone, and then you have got this space on the occipital end. So the anterior cranial fossa is the one that is in front here. The middle, you have got the middle cranial fossa, and then behind you have got the posterior cranial fossa. All these fossa together accommodates the brain, but there are specific features that are of importance to each one of them. So again, you can see the anterior cranial fossa. Look at the bones which bind it or cover it. You have got the frontal bone in green. You also have got the ethmoid bone is also in green, okay, and this part of the sphenoid bone, only part. And then the middle cranial fossa has got also part of the sphenoid bone, the temporal bones which are on the sides, and the parietal bone. The posterior cranial fossa is also going to have part of the sphenoid. You know, this big bone here on the middle is a sphenoid, and then the parietal bones also, and the temporal bones on the sides, and the occipital bone. The anterior cranial fossa is the superior most cranial fossa. As you can see, even here it is the topmost. It is very much on top in comparison to these others, and it accommodates the anteroinferior portion of the frontal lobe of the brain. Because what is happening is that the brain is sitting here. The front of the brain, you call that as a frontal lobe. It has got, so the way you name the parts of the brain is just following the bones: frontal lobe, the parietal lobe, the occipital lobe, the temporal. So the down part of the brain is going to sit here, but specifically the frontal aspect of the brain. So that's why we are calling it as the anterior inferior portion, the front down portion of the frontal lobe of the brain. When you look at the borders of the anterior cranial fossa, it the many bones that makes up the anterior cranial fossa, we've said, is the occipital bone, the ethmoid bone, and the sphenoid bone. So when you look at the front, this is the front, that's the anterior end. So you have got the anterior lateral aspect, okay, in front, but on the sides, what bone can we see here? That is the frontal lobe, or sorry, the frontal bone. So the inner surface of the frontal bone is what is going to make up the anterolateral border. And then you have got the posterior borders. Now the posterior borders, again behind here, you can see you have got it posterior on the sides, posterior lateral, and then you have got posterior but on the medial aspect, that's posterior medial. So posterior medial, you have got the sphenoid bone. Specifically, can you see this part of the sphenoid? We call it the limbus of the sphenoid bone. Okay, that aspect. And then posterior lateral, you can see these parts. We say the sphenoid bone has got a body, the lesser wings, which are the ones that you can see, and the greater wings, which are these big ones that you can see. So posterior lateral, you have got the lesser wings of the sphenoid bone. And then the floor, like this down part, that's where we have got the sphenoid, the ethmoid bone, and also part of the body. Can you see this is actually the part of the body of the sphenoid and part of the lesser wings? You can see part of the lesser wings of the sphenoid also, and also the frontal bone. So those are the ones that are making up the floor. Does that make sense? Good. So when you look at the front, the anterior cranial fossa, it has going to have some cavities within it, some openings. And those openings which are there will be used for the passage of things like nerves, arteries, veins, and for communication between the inside of the brain to the other openings, for example, the opening of the orbit, the nasal opening, and these other openings. So, what are the openings that we are going to see in the anterior cranial fossa? The first opening we need to understand is these openings in the cribriform plate. Earlier, when we were talking about the bones, we said that we have got a lot of openings. This is a cribriform plate, which is part of the ethmoid bone. So this is the ethmoid bone here. You can see that on top we have got what we call the cribriform plate, and on the sides of this cribriform, can you see that on the middle of the cribriform plate we have got this projection which we call the crista galli. On the sides of the crista galli, that's where I've got a lot of these openings. So we call them the foramina of cribriform plate. They don't have any special name. We just name them looking at where they are. The openings in the cribriform plate, or foramina in the cribriform plate. That's it. Okay, so those are the openings. What passes here, please? You need to, so for the openings, you need to know the opening, the location, and what passes there. So what to pass through these openings, we had mentioned to say it's cranial nerve number one. Remember cranial nerve number one, the olfactory nerve, the one that helps us to smell. When someone is swimming, a clinical application is that as someone is swimming, they can actually one type of protozoa, which is known as Negleria fowleri, which is actually an amoeba, can enter through the nose and then go through cranial nerve number one through the openings in the cribriform plate, and then it's going to go to the brain and then cause infection there. We'll discuss more about the infection in microbiology, parasitology. So that is about the foramina or the cribriform plate that we have to know there. Another opening, we have got the anterior ethmoidal foramen and the posterior ethmoidal foramen. Remember we said that we have got the ethmoid bone, okay? Like even this same crista galli, there is actually part of the ethmoid bone. So in this same ethmoid bone, we are going to have these openings. So in this kind of view, you can't see them unless if we took a cross section. That's when you're able to. If we took a sagittal section, that's when you'll be able to see. So the anterior ethmoid foramen is going to transmit the anterior ethmoid artery, anterior ethmoid nerve, anterior ethmoid vein. So nerve, artery, vein normally move together. The posterior ethmoidal foramen transmits the posterior ethmoidal artery, nerve, and vein. Nothing really too complex there, isn't it? And then you can see that somewhere on the junction between the frontal bone and the ethmoid bone, you are going to have a small opening there that is known as a foramen cecum. Foramen cecum. This is actually going to go and open on the top, like the hard palate. When we'll be talking about the mouth, you are going to see the foramen cecum. So it's opening there in the mouth. Foramen cecum. You can see again, these are the this is the passage of cranial nerve number one in the foramina or the cribriform plate there. Okay. So when you get to fracture the cribriform plate, what can happen is that contents, because the cribriform plate, you can see there's a communication between the nose and the cranial cavity where the brain is, and you know the brain is surrounded by meninges, the dura mater, arachnoid mater, and pars mater, and these guys will contain cerebrospinal fluid. So if there's an injury to this cribriform plate, someone will start having a drip of that cerebrospinal fluid through the nose. So that is known as the cerebrospinal fluid rhinorrhea. Rhinorrhea is just telling us of a running nose. So that is on the anterior cranial fossa. Is there any question on the anterior cranial fossa? Okay. So you can see here, so in this kind of section, you can't see the ethmoid foramina, but in a section like this one, can you see these openings here? So just like you have got these openings, that's how you are going to have the ethmoid foramina openings like that. If you take a section like this one. So these ones specifically, they are going to be opening in the nose, and later on when we start talking about the nose, they are the anatomy of the nose. You are going to understand where each one of these, the anterior ethmoid foramina, is going to open. Actually, we also call them the air sinuses, just like we have got this one in the frontal bone, the frontal air sinus. The middle cranial fossa is said to be butterfly shaped. This is the one that you can see here, and it's going to also form a location for the brain. You can see the bones that make it up in these colors. So again, we need to understand the borders and the canals that are found in the middle cranial fossa. So the middle cranial fossa face the borders. This is going to be covered by three bones: the sphenoid bone and the two temporal bones. Okay. The sphenoid is this guy on the middle here, and then you have got the two temporal bones on the sides. So when you look at the boundaries in front and on the side, so anterior, lateral, so here, anterolateral, you can see these are the lesser wings of the sphenoid bone. This was the same border which was a posterolateral border for the anterior cranial fossa, but now it is the anterolateral border for the middle cranial fossa. That's the lesser wing of the sphenoid. Anteromedial, it is the same which was the border for the posterior posteromedial border of the anterior cranial fossa. That is the limbus or the sphenoid. Okay. And then posterior lateral, posteriorly but on the sides, you have got superior border of the petrous part of the temporal bone. You remember the temporal bone had different parts. The inside of the temporal bone is very hard. That's why we call it the petrous part. The outside, we are going to have what we call the mastoid part, the squamous part. So the upper part of the petrous part of the temporal bone here, this is posterolateral. And then posterior medial, you can see where we are going. We are going back to the sphenoid bone. And this part of the sphenoid bone, this is actually a part of the body of the sphenoid. This is where the pituitary gland resides, and that's known as the pituitary fossa or hypophyseal fossa. Specifically, is found on what is known as the sella tussica. The posterior aspect of the sella tussica has got what we call the dorsum sella. The front is the tuberculum sella. So the posterior part here, this is what is forming the posterior medial border of the medial cranial fossa. That is the dorsum sella of the sphenoid bone. And then if you look at the floor is going to have these big wings of the sphenoid. That's the greater wing of the sphenoid, and also the squamous part of the temporal bone, including also some part of the petrous part. Okay, you have got the hard part of the temporal and the flat part of the temporal bone, including the greater wings of the sphenoid. And actually, the body of the sphenoid, because you can see the entire of this is the body. So those are the parts that are making up the floor of the cranial midi cranial fossa. Is that okay? Okay. Again, what are the contents found in the middle cranial fossa? As we said, at this point we have of the sphenoid bone. This is actually part of the body of the sphenoid bone. We have got the sella tussica, and the sella tussica is going to have a depression known as hypophyse or the pituitary fossa. We are going to find the pituitary gland. The sella tussica, as we said earlier on, is surrounded by the anterior and posterior clinoid processes. You see them properly on the sides. You can see the posterior clinoid process, this side, and also these ones on the sides. These are the parts that surround the sella tussica. And this is for the attachment of what we call the tentorium cerebelli. So the tentorium cerebelli will be separating the cerebellum, because down here you are going to have the cerebellum, while on top you have got the cerebrum. So between the two you are going to have a tent separating them, and that's known as the tentorium cerebelli. So that is where he's going to be able to attach on these anterior and posterior clinoid processes. And then we also need to understand the foramena that are found in the sphenoid bone. We have got quite a lot of foramina, starting not just the sphenoid bone but the middle cranial fossa. Starting first with the foramina that are found in the sphenoid bone itself. There are a lot. Okay, we did also discuss about them when we were talking about this bone. You can see we have got this big opening on the side that's known as the superior orbital fissure, and then we have got the foramen rotundum, foramen ovale, and foramen spinosum. So to know these three types of foramen, you can use the simple mnemonic ROS, ROS. So starting from anterior going posterior, foramen rotundum, foramen ovale, foramen spinosum. Superior orbital fissure is going to open in the eye. In the lesser wing, you also have what we call the optic canal. This is also opening in the eye together with the superior orbital fissure. Okay, so starting now with the optic canal, what passes in the optic canal is actually the optic nerve, which is cranial nerve number 2. Besides the optic nerve, you are also having the ophthalmic artery. Ophthalmic artery is the artery that supplies the eye. So it makes sense that it should pass through here, because optic nerve is going to the eye together with the ophthalmic artery. The superior orbital fissure has got a lot of contents, and you need to know the contents in order. But just for now, so that you can just know the general, you have got cranial nerve 3, 4, 5, and 6. That would be easy, isn't it? Cranial nerve 3, 4, 5, 6. Remove 1 because remember it was passing through the foramina in the cribriform plate. 2, remove it because it's passing in the optic canal. So 3, 4, 5, 6. Those are the ones that are passing the superior orbital fissure. Now, for cranial nerve number 5, cranial nerve number 5 has got 3 branches. It has got V1, which is the ophthalmic division. It has got V2, which is the maxillary, and it has got V3, which is the mandibular. So of these 3 branches, it is only V1 that is passing through the superior orbital fissure. Actually, what happens is this now it can help you to remember. You can see these foramina here, starting from superior orbital fissure, foramen rotundum, foramen ovale. So superior orbital fissure is the one having V1, which is ophthalmic branch. Foramen rotundum and foramen ovale. So you are going to follow the numbers like that. V1 on top in the superior orbital fissure, you go down V2 and then V3. Okay. So foramen rotundum is the one that has got V2. And then you are going to have foramen ovale. So the mnemonic of the contents in foramen ovale. Now let me first finish on the superior orbital fissure. We've said that only V1 is going to pass through there, but besides the nerves, you also have what we call the ophthalmic vein and the sympathetic fibers. So can you say that the ophthalmic vein is also passing in the superior orbital fissure, just like also in the optic canal, because you had the artery there, you expect also the vein. The foramen rotundum is having the maxillary branch of the trigeminal, that's the main content there. And then the foramen ovale, you can use the mnemonic male to look at what is passing through there. M is for the mandibular branch of the trigeminal, that is V3. And then A is for the accessory meningeal branch of the maxillary artery. So you have got a maxillary artery and it has got a lot of branches. We'll discuss all the branches. They can bring them for in your practical test for you to identify. So the maxillary artery, specifically the accessory meningeal branch, is going to pass there. And then the L is the lateral petrosal nerve. And then E is the emissary vein. Emissary veins are just veins that connects the skull, the contents inside the brain to the outside. So those are the contents. And then for foramen spinosum, it has got the middle meningeal artery, middle meningeal vein, and the meningeal branch of cranial nerve number 3. So you can see not cranial nerve number 3 itself, but the meningeal branch. So to make work easier for yourself, superior orbital fissure is on top. So the topmost branch of cranial nerve number 3 is V1, which is ophthalmic. Foramen rotundum is what follows. The branch that comes next is V2, which is the maxillary. Foramen ovale is what comes next. The branch that follows is V3, which is the mandibular. Foramen spinosum, it is just a branch of V3, which is the meningeal branch. It's going to the meninges, which is the dura mater, arachnoid mater, and pia mater. Okay, so you can see this foramen again here, just made bigger. Can you see that you have got other foramina in this, but these are going to be part of the posterior cranial fossa, but we can talk about them even now. You have got the carotid canal. Can you see the carotid canal here? And then you have got foramen lacerum. Foramen lacerum is more on the medial aspect. When you look at this is foramen rotundum, foramen ovale, foramen spinosum, but medial to that is foramen lacerum. So these are the contents of the superior orbital fissure in order. They can just bring this picture, they ask you to identify the contents in order. Okay. You can use the mnemonic leave free to see no insult at all. So starting from the top going downwards. Remember we said that the contents generally for the names are got cranial nerve number 3, 4, 5, and 6. And we said you also have got the ophthalmic veins and ophthalmic artery. Is actually ophthalmic veins, just the ophthalmic artery passes in the optic canal. So leave free to see no insult at all. You have got lacrimal nerve. Lacrimal nerve, this is actually a branch. These are branches, the lacrimal nerve and the frontal nerve. These are branches coming from V1. Remember we said it's only V1 that passes through the superior orbital fissure. So to tell properly what is happening is that you have got cranial nerve number 5. Cranial nerve number 5 is going to give you a nerve, a branch known as the ophthalmic nerve, which is V1. V1 will give you branches again to give you the lacrimal nerve and the frontal nerve. At least these two, they are not the only branches. At least these two are the ones that pass in the superior orbital fissure. So lacrimal is the first one, followed by the frontal nerve. The next nerve is the superior division of cranial nerve number 3. Okay, the superior division, you can see this one here. So this is first the trochlea, and then the frontal nerve, and then the lacrimal nerve. The superior ophthalmic vein is the next. So look at this. You have got first the 3 nerves, and then you have got a vein. It's important for you to know this. 3 veins, 3 nerves, and then a vein. The vein is actually a superior ophthalmic vein. Okay, superior ophthalmic vein. Now this is not supposed to be cranial nerve number 3. This is supposed to be the ophthalmic vein. Hope you take note of that. So the first nerve that is going to appear here is actually going to be the trochlear nerve, which is cranial nerve number 4, before you can come to the lacrimal nerve and the frontal nerve. Please just make the correction on what I've written this side. So trochlear nerve is the first, which is cranial nerve number 4, and then you have got now the frontal nerve, and then you have got the lacrimal nerve. Okay, and then after that Now you have got the superior ophthalmic vein, because the ophthalmic vein has got the superior part and the inferior part. So that's the superior part. And then you are going to continue going down. You are going to still find the other nerves which are inside this region. But now we'll talk about more of these contents, because the way they are organized, you are supposed also to know what are these things that are forming like a circle here. So you need to also know these muscles. So that's why I will not talk it much detailed. For now, you can simply know that in the superior orbital fissure, you have got cranial nerve number 3, 4, 5, 6, and the ophthalmic veins. You also have openings in the temporal bone, as we said. In the temporal bone, you have got a carotid canal, foramen lacerum. These are the at least the big ones, and also the opening for the greater petrosal nerve. So even from the word hiatus means opening. So hiatus for greater petrosal nerve. You are going to understand what the greater petrosal nerve is and how they join. You understand that later on. But here, take note, there's going to be this opening for the greater petrosal nerve, and then there's also an opening for the lesser petrosal nerve. There's also the carotid canal. You even saw the carotid canal, this one. Even from the name carotid. Let me remind you of your general anatomy that you did. From the heart, you have got the arc of the aorta, from where you're going to have those three many branches. Of those three many branches, you have got the brachiocephalic, you have got the common carotid, specifically the one that is going to the left, isn't it? The left common carotid and the left subclavian. Now, from the common carotid arteries, what happens that those, as they go up, they are going to bifurcate into the internal carotid and the external carotid. Okay, so this is the carotid canal that you can see here. The carotid canal is going to be for the internal carotid, because it's the one that goes to supply blood to all the contents that are inside the head and the neck. So that's the internal carotid. The external carotid will be supplying the parts of the head and neck which are outside, like the outer aspect, but the inside of the head is the internal carotid. So take note of that. Carotid canal, the main content is the internal carotid. It's actually medial to the foramen ovale. You can see foramen ovale is this one, and then this guy is more on the medial aspect. Foramen lacerum, this guy is found on the junction between the sphenoid, the temporal, and the occipital bone. You can see this guy here. This is the sphenoid, temporal, and occipital is going to be behind here. Now, foramen lacerum in adults, there is actually nothing that passes there. There is just cartilage. So if you go and look, if they will be doing your DR, you'll not actually see this opening. Why? Because there is cartilage there. That's why you can't see the opening, because it's filled by cartilage. So those are the openings, and you can see this is a internal carotid that we're talking about. This is the opening here, which is the carotid canal, where it is passing and then going like that. You can see the ophthalmic artery coming also from the internal carotid. It will go together with the cranial nerve number 2 to go to the eye. The posterior cranial fossa, this one is the deepest and the posterior most of the three, and it accommodates the brain stem. The brain stem is the midbrain, the pons, and the medulla oblongata. And besides accommodating the brain stem, it also accommodates the cerebellum. Okay. What are the borders of this cranial fossa? When you look at the anterior aspect, because the many bones that makes up this fossa is the occipital bone and the two temporal bones. So the anterior medial in front, but medially you have got the dorsum sella of the sphenoid, which was the posterior aspect, isn't it? The posterior border of the middle cranial fossa. Dorsum sella, it was actually the posterior medial border. Dorsum sella of the sphenoid bone. And then anterior lateral on the sides, you have got the superior border of the petrous part of the temporal, which was actually the posterolateral border of the middle cranial fossa. And then posteriorly, on the posterior aspect here, you have got the internal surface of the squamous part of the occipital bone, the flat part of the occipital bone. And then the floor down here, you are going to have the mastoid part of the temporal bone, which is this part, and the squamous, condyle, and basilar parts of the occipital, just majority of the occipital bone. Okay, that is what will make up here. So what are the contents that you'll be able to see in the posterior cranial fossa? You have got the cerebellum, the medulla oblongata, the pons, and the middle brain, which midbrain, and these we call them the brainstem. These are actually the brainstem will pass through the foramen magnum, this one, and then they'll continue as a spinal cord. So what are the openings found in the posterior cranial fossa? Starting with the openings in the temporal bone, you have got what we call the internal acoustic meatus. Okay, the internal acoustic meatus. You can just on the side here, can you see this opening here? This is the temporal bone. That's why I've got the internal acoustic meatus. The internal acoustic meatus, the function or the contents that pass there, you have got the facial nerve and the vestibulocochlear nerve. You need to know this. You can see like cranial nerve number 7, which we the facial nerve, and the nerve that we use for hearing. These two nerves move together, passing through the ear. That is why if there is infection of there is a problem with hearing because of, let's say, a schwannoma, okay, there is an inflammation maybe, or a tumor of the nerve, let's say one of these nerves, the other one most likely is going to also be affected because they move together. So facial nerve and vestibulocochlear nerve will pass in the internal acoustic meatus. Now you also have an artery that is going to supply the contents that are found in the middle ear, actually the inner ear. That is known as the labyrinthine artery. You are going to understand how the labyrinthine artery is formed. So you can see that's the internal acoustic meatus. And then the openings in the occipital bone, the first one you have is the foramen magnum, the biggest opening of the head, or the biggest foramina of the head. It has got a lot of contents. You can use vamps ATM, like vampire. Vamps ATM. The V is the vertebral arteries, which are running on the sides of the vertebral bones. And then the A is the anterior spinal artery. You also know how it is formed. It's actually formed from the vertebral arteries, and they need to be able to connect to form one artery. The M there is the meningeal branch of the cervical nerves. P is the posterior spinal arteries. You have got anterior spinal artery. It is only one, but posterior spinal is not an artery, but arteries because it's on both sides. And then the S is the spinal part of the accessory nerve. You know the accessory nerve, cranial nerve number 11. It has got the cranial part and the spinal part. So the spinal part will pass through this opening. And then the other A here is the ala and the apical ligaments of the dens. Actually, the axis and the atlas, when they connect, they are going to be held by these ligaments, which we call the ala and the apical ligaments. And then the T is the tectorial membrane. And then the M is the medulla oblongata, which will continue as a spinal cord. So these are the main contents of the foramen magnum. And then you have got also what we call the jugular foramen. The jugular foramen is on the lateral aspects. You can see it is here. Okay, where is the place? Okay, here. This is where we're going. You can see the jugular tubercle. This is the tubercle, but the foramen is here. So the jugular foramen, even from the word, do you know any vein that has got the word jugular in it? So we have got the those jugular veins. Okay, so what are the contents that pass through the jugular foramen? This one is situated on the sides of the foramen magnum, and it transmits cranial nerve number 9 and cranial nerve number 10 and the spinal accessory nerve. Okay, the spinal accessory nerve, which is descending, going downwards. But how come? You can see the spinal accessory nerve is in the jugular foramen. We said it also passed through the foramen magnum. So what will happen is that in the foramen magnum, it's like it's going up and then it will come now down to pass through the spinal accessory, to pass through the jugular foramen to continue to descend. So it went up and through the foramen magnum and then started coming down through the jugular foramen. We call it a jugular foramen because we have got the internal jugular vein passing there, inferior petrosal sinus, sigmoidal sinus, meningeal branch of the ascending pharyngeal and occipital arteries. Now, these others might not make sense for now because it is very hard for you to know a content that you really don't know how it's formed or what it plays. So you understand them very well if you talk about the sinuses. For if we say, okay, sorry for that, the network just cut. I don't know what happened. So we are talking about the jugular foramen, and we are saying that the main content, the reason as to why it even gets the name jugular foramen is because of the internal jugular vein. Please, not external. External is on the outside. Internal is the one that will go to the inside of the. It's actually the one collecting blood from the inside of the head, taking it back to the heart. Okay, so please you make sure that you know that. So can you see cranial nerve number 7 and 8, we are passing in the internal acoustic meatus. Cranial nerve number 9, number 10, and number 11, they are passing through the jugular foramen. So where is cranial nerve number 12 passing? So cranial nerve number 12 is passing in the hypoglossal canal because it's actually the hypoglossal nerve. So can you see the hypoglossal canal is just like on the very sides of the foramen magnum, just on the very sides here. Okay, that's where this one is. And you can see for the jugular foramen on this side, that's the jugular foramen there, where I've got the glossopharyngeal nerve, cranial nerve 9, 10, and 11, and the internal jugular vein. So now, as an overview of all the openings of the head when you are viewing it from the top and their contents. Let's start with the cribriform plate. You can see that we have got the cribriform foramina. The anterior, the cribriform plate has got the foramina of the ethmoid bone, or the foramina of the cribriform plate. We have got olfactory nerve, cranial nerve number 1, which is the main content that will pass there. Remember, we also have an opening in front here, which is known as the foramen cecum, but not shown. And then we have got the optic canal, which is in which bone? The optic canal is in the sphenoid bone. And what passes there is the optic nerve and the ophthalmic artery. Those are the main contents. And then we have got the superior orbital fissure. Superior orbital fissure, we said it has got what cranial nerves? 3, 4, 5, 6. But the 3, cranial nerve number 5 is only V1. Okay. And then we have got also the superior ophthalmic vein. Not the ophthalmic artery, but vein. That's the superior orbital fissure. And then when we go to the foramen that are found on the greater wing of the sphenoid, starting with foramen rotundum, the main content there is the maxillary division. That is V2 of the trigeminal nerve. And it is on the side there. The next is foramen ovale. We said it is V3, which is the main division. So this is actually a mistake here. They've written V2. It's not V2, V3. That's mandibular. Mandibular division is V3, not V2 of the trigeminal. Remember, we said that foramen ovale, we can use the mnemonic male to talk of all the contents. Don't forget the male there. Okay, this is the foramen ovale. And then we have got foramen spinosum, which is down. And the many branch there, we are going to have the meningeal branch of cranial nerve number 3, not cranial nerve number 3, but V3, which is the trigeminal nerve, cranial nerve number 5, but the third branch, which is the mandibular. So from the mandibular, we have the meningeal branch, and then in the foramen spinosum, we also have the middle meningeal artery. This is a very important artery. Actually, it's the middle meningeal artery that can be affected when there is an injury to what we call the terion. Okay, the pterion is that part of the head where four bones meet. If you remember when we were talking about the bones, so if there is a fracture at that point, you can injure the foramen, the middle meningeal artery, and that is going to lead to what is called the epidural hematoma. Okay, that those are exam questions. And then you can see at this point where we've got the carotid canal. You can even see the carotid artery coming from there. That's the main content of the carotid canal. You can see that actually when this guy, the the internal carotid artery is going to pass through this canal, it is passing on top. There's on top you have got another foramen which we call the foramen raceram, and we say that this foramen raceram doesn't have anything in people. It is filled by cartilage in life. That's why you will not see it when you do your dissection. And then when we continue, we've got the internal acoustic meatus. The main content says cranial nerve number 7, number 8, and then the arteries that supply the inner ear, which is the labyrinthine artery, including the vein, because normally these move together. And then we have got the hypoglossal canal. Since we have said that internal acoustic meatus contains cranial nerve 7 and 8. Okay. Remember how we started? Cranial nerve number 1 passed where? In the cribriform plate. Cranial nerve number 2, it is in the optic canal. Cranial nerve number 3, number 4, number 5, and number 6, those passed where? In the superior orbital fissure. Again, cranial nerve number 5, other branches, it is in the foramen ovale, foramen rotundum. And then cranial nerve number 7 and number 8 in the internal acoustic meatus. Cranial nerve number 9 and number 10, it is in the jugular foramen. You can see where the jugular foramen is, okay, on the sides here. Besides those, you also have got the accessory nerve, which is cranial nerve number 11. So cranial nerve number 9, number 10, and number 11. And the internal jugular vein in the jugular foramen. So we're remaining with one nerve, cranial nerve number 12. Where does it pass? It's in the hypoglossal canal. That's where it is passing. Foramen magnum, you have got the spinal cord here. Sometimes we are going to say medulla oblongata because medulla oblongata is what continues the spinal cord. And you also also the vertebral arteries. Okay, they also pass here and some other contents. So these are the parts of these are the openings in the cranial fossa. When you look at the head from down, because this is when you've cut out the top part of the head and then you are looking from the top, but here you are looking from the down. Those same openings, can you see where they are now? So you have got the foramen ovale, you can see where it is here. Just next to the foramen ovale, you have got foramen spinosum at this point. And then you have got, you can see this is the foramen magnum. On the side of the foramen magnum, that's where you have got the hypoglossal canal. And then you have got the jugular foramen, it is more lateral to the hypoglossal canal. And then you have got also the carotid canal. The carotid canal is more on the anterior aspect of the jugular foramen. Take note of that anterior aspect. This diagram can come in your practical test. Okay, and then you also have an opening. Look at this gamma guy here. Can you see this is the styloid process? So we have got what we call the stylomastoid foramen. That's where the facial nerve will be able to live. It will be able to pass there also. Yes, please. Is there a question? Okay. So just for your orientation sake, if you want to identify the foramen on this view, first identify the foramen magnum. On the side of the foramen magnum, you have got the hypoglossal canal. Lateral, more lateral to the hypoglossal canal, that's why I've gone to have the jugular foramen. Now in front of anterior to the jugular foramen, that's where I've got carotid canal. Okay, carotid canal. And then when you go again more in front, you have got the foramen spinosum and the foramen ovale. Okay, remember you have got we said you can use the numeric rows. So they're supposed to be foramen rotundum, foramen spinosum, and then foramen ovale. actually foramen rotundum, ovale, and spinosum. But here we can't see the foramen rotundum. So I've got the foramen ovale. Just a bit posterior to it, you have got the foramen spinosum. Okay, so this is the view from down. Of course, there are many other things that we are going to be able to identify later on, but not for now. Let's not put everything together. So that is it on the cranial